another edition of Lone Star Family Health Center's The Checkup. I'm Elena Trevathan and I'm interning here at the marketing department, and I'm taking over the vlog today. This week is incredibly special because we are celebrating National Community Health Worker Awareness Week. Our community health workers are truly the heart of our outreach and work hard behind the scenes and out in the community to ensure everyone has access to care and resources. Welcome. To start off, introduce yourself and explain what a community health worker does.
Well, thanks for having us. My name is Derick. Community health workers are, it's basically, it's a broad range of stuff that we do, but the easiest way to explain it is we're the middleman between the doctor and the patient. So anything that they need help with, non-medical related, it could be food, it could be housing, it could be shelter, and then a wide range of other things, but that's it in a nutshell.
My name is Perales, and what a community worker does is pretty much assist patients on whatever the need they're having at the moment. It can require resources for, like he was saying, shelters, food. It can also be referrals, communication with the providers. So we do a little bit of everything, and it's never the same. Like, we always do something different.
That's true. Every day is probably a little bit different for you. What does a typical day look like, though, for a community health worker, and how do you work alongside our providers to support our patients?
A typical day is, like Liz said, it's really not the same every day. Like this morning, I've been helping out a patient with getting on disability and help with Medicaid. And then as far as like how we work alongside the providers, basically the provider will give us, they see the patients obviously, and then they're at some point within the appointment, the need comes up. So they express that to the provider reaches out to us. And a lot of times, that's why I say that we're like the middlemen, because I guess sometimes there's a, I don't want to say fear, but the patients don't always tell the providers everything, like what they really need. So the provider will have one explanation of what's going on, and then when you talk to the patient, it's not necessarily different, but there's extra details that will affect the situation. So it's always, so after we get the referral from the provider, then I always talk to the patient to see exactly what's going on, to make sure that everything is, I have the right understanding. And then basically from there is just figuring out the best like plan of action and helping them get to wherever they're trying to get to. We have a lot of resources at our disposal, so I'm working alongside Amber, our Medicaid person. She's given me some tips to help speed up the process.
National Community Health Worker Week is all about recognizing the unique impact that you'll have. What is a specific moment or success story from your time here that made you proud to be a community health worker?
It was probably the time where we had a patient that had recently found out that he had cancer. And, like he was desperate because, it was like all of a sudden, news. So he didn't know where to start. So we kind of started, by looking to give him or find him the assistant that he would need, the medical assistant, to get his treatment. We went ahead and put him on a program, and he started receiving all his chemotherapy and all the treatment, and he is cancer-free now.
That's awesome.
Seeing the relief of someone that gets help, that has like just been trying, like spinning their wheels, trying everything that they can to get help, but then they're either not getting what they need or they don't know where to even start. Like the relief after you help them find exactly what they're needing. Like that's, to me, that's the one thing that's, it never gets old.
You'll do such amazing work here.
Thank you.
Many people might not realize that community health workers do a lot of work outside the health center's walls as well. Can you tell us about some of the outreach, education, or community events you participate in?
So, we do a lot of like outreach, different schools, Depending on what time of the year we have, it coincides with the seasons, like what's going on, like school time, or we have a lot of like trunk or treats during Halloween's, a lot of Christmas related stuff during Christmas time. So this past weekend, or not weekend, I went Friday to like a community celebration in spring, and just people that, like, the fire department was there, just different vendors from the community come out, and then we just spread the word of Lone Star, tell people what we do, tell people where we are, give them an idea of the different services that we provide, because a lot of people, because of the name, a lot of people associate us with the school, so they might have heard of us, or they thought that they heard of us, so it's always good to be out at events like that, because when they hear Lone Star, because Lone Star College is so predominant here, they just assume, oh, you work with the school, and it's like, no, like, we're a clinic, we have 5 different locations, so it's always good to get out and spread the word, so to speak.
What do you find most rewarding about serving our local community? And what is your biggest hope for the future of community health?
The most rewarding would be, like I was telling you before, that whenever you're able to help the patient, and their health gets better, that's very rewarding for me, because it makes me feel like whatever I'm doing is going somewhere. It's, we're just not helping, we're actually making it happen for the patient to find what they need. I really, really feel like there should be more community health workers out there, because we do make a difference. Sometimes you're able to see it, sometimes people don't see it, but we do make a difference in a lot of people by just helping or providing resources.
The one thing that I've noticed is a lot of patients, I guess there's there's certain things that they don't really feel comfortable talking to the doctor about or asking, because nobody likes to look dumb. So if I'm not really educated on a specific topic and they say something and I don't know what it means, but I don't want to look dumb, or I don't want to ask a stupid question, so I'm embarrassed to ask, or maybe I don't know what to ask. That's where I've been able to, I feel like that's one of the areas where we're able to make like a pretty big impact, because like we have access to the doctor, so it's something like a basic question, but it's something that like weighs heavy on their mind. So just giving people the peace of mind to understand like what this appointment, or what they were just told in this appointment. I feel like, to me, stuff like that, like, it's small things. It's not necessarily going to change everything about their life, but just that small question that they got answered, that they felt comfortable enough to ask me, and then I asked the provider to get that question answered for them. Like, that really helps them be able to leave here with the peace of mind.
Is there any last things that you would like our audience to know about community health workers, or what y'all do?
I would like for them to know that a lot of the times, if we don't get a message from the provider, they don't know that we're here. But I just want to let them know that we're here for the community. We are here for Lone Star patients. And we are open to talk to anybody and to help anybody. We don't have to have a referral from the doctor. They can just ask for us, and we're here to help.
We help with a wide range and wide variety of different areas and topics, and really, I always tell the providers, even if you don't think it's something that we can help with, like, we have a lot of resources that we have available. So even if it's something that they don't think that like is in our scope of what we do, like, still send it to me, because you never know. Like, I've helped people out with a lot of stuff, so it's like, or if we don't have access to it, we know people that can get them help. So nothing is, I always tell people, no matter what, as crazy as it may seem to you, like, we probably know somebody that would be able to help you out with it.
Thank y'all for sitting down with me today and talking. Hopefully, you learn the importance of community health workers and what they do for our community. Lone Star Family Health Center is always looking for qualified people, so check out our careers on our website or social media posts for updates. If you are a patient of Lone Star Family Health Center, we hope to see you soon. If you are not and would like to become a patient or learn more about our services, you can find us by visiting www.lonestarfamily.org or call us at 936-539-4004. Subscribe, stay tuned, and we'll see you at your next checkup.